Welcome to The Explainer. You know, studying for MedSurg can feel like you're trying to drink from a fire hose, right? It's just so much information. But don't worry, in this review, we're going to get laser focused. Our whole goal here is to cut through all that noise and really concentrate on the high-yield concepts, the stuff that shows up on exams over and over again. This isn't about memorizing every single tiny detail. It's about deeply understanding what matters most for keeping our patients safe. So what's the end game here? It's to become a safe practicing superhero nurse. And what that really means is being a clinician who can take all this deep knowledge, combine it with sharp critical thinking, and keep patients safe, especially when things get intense. That's the mindset we're building today. Okay, let's dive right in with our first major topic, infection. And specifically, we are going to decode HIV. Now, this is a topic that really demands precision. You have to have a crystal clear understanding of how this disease works. Let's kick things off with a classic NCLEX style question. So, you have a patient with HIV. Their CD4 count is 450 and they have no symptoms. What's the right classification here? Just think about it for a second. Don't worry, we're about to break down everything you need to know to answer this one with total confidence. So, first things first, you have to understand the enemy. Human immunodeficiency virus, or HIV, is a very specific kind of virus known as a retrovirus, and its one and only mission is to attack and destroy the generals of your immune system's army. I'm talking about the CD4 plus T cells. You'll also hear them called T helper cells. Without these generals, the body just can't coordinate an effective defense against any other invaders.
Now, if it's left untreated, HIV follows a pretty predictable path. It all starts with this acute phase where the person feels like they have a really bad flu, and they're highly infectious. This is followed by a really long asymptomatic phase. It could be up to 10 years, where the virus is just silently, steadily destroying those CD4 cells. Eventually, that leads to a symptomatic phase, and then ultimately to AIDS, which is a total collapse of the immune system.
Okay, this right here, this is probably the most important gotcha for HIV on any exam. The diagnosis of AIDS isn't just a feeling or based on symptoms. It is a specific objective number. You have to know this bright line. A CD4 count that drops below 200 cells per microliter. That's the magic number. Or, if the patient develops one of those specific AIDS-defining opportunistic infections, they get the diagnosis of AIDS no matter what their CD4 count is. So, what is our job as a safe practicing superhero nurse? Well, it really boils down to this. We have to make sure our patient sticks to their lifelong antiretroviral therapy, or ART. We're constantly monitoring key labs like their CD4 count and viral load. We're working to prevent those opportunistic infections, and we provide so much psychosocial support. A huge teaching point now is U equals U. Undetectable equals untransmittable. This is a game changer. All right, let's circle back to that question we started with. The correct answer is C, asymptomatic chronic HIV infection. And the reason is really simple when you know the rule. The patient's CD4 count of 450 is way above that critical AIDS threshold of 200, and they don't have any symptoms. This puts them squarely in that long chronic phase of the infection. Let's move on to our next section. We're going to stay in the world of infections, but now we're going to unmask syphilis. This is an ancient disease, but it is making a major comeback. And let me tell you, it is an absolute favorite for test writers. The number one thing you absolutely have to know about syphilis is its nickname, the Great Imitator. Why? Because its symptoms can look like so many other diseases, which makes it incredibly tricky to diagnose. And that means as a nurse, you have to have a really high index of suspicion. So let's apply this. Picture this. A patient comes in with a rash on the palms of their hands and the soles of their feet. It doesn't itch, and they also just feel awful, kind of like they have the flu. What stage of syphilis is this most likely to be? Primary, secondary, tertiary, or latent? Take a second. So to answer that, you just have to know the stages. Primary syphilis, that starts with a single, painless sore called a chancre. Then comes secondary syphilis. This is when it goes systemic all over the body, causing those flu-like symptoms and that classic telltale rash on the palms and soles. Both of these first two stages are highly infectious. If it's not treated, it can move on to the devastating tertiary stage years later, causing organ damage that you just can't reverse.
And this right here is exactly why this matters so much to us as nurses. Our ability to recognize the signs of primary and secondary syphilis is the key. It's everything to preventing a patient from ever getting to that catastrophic tertiary stage. If we catch it early, treatment can completely cure the infection. This is a huge, huge patient safety and public health responsibility.
So what's the treatment? For your exams, I want you to burn this into your brain. The answer for all stages of syphilis is penicillin G. It is the definitive, gold standard treatment to completely eradicate the organism.
So, let's go back to our question. The correct answer is B, secondary syphilis. That very unique combination of a rash on the palms and soles, plus the systemic flu-like symptoms, that is the textbook hallmark presentation of the secondary stage. That's the key connection you have to make.
All right, let's pivot to a totally new topic area, oncology. We're going to focus on some absolutely critical, non-negotiable nursing priorities when it comes to treating breast cancer.
Let's frame this with a real critical thinking question. You have a patient who's had a left-sided mastectomy, and they also had their lymph nodes removed. Which one of these instructions is the absolute top priority? I want you to think about lifelong patient safety.
To understand the priority here, you have to understand the risk. When those axillary lymph nodes are removed, the body's plumbing system, the lymphatic drainage on that side, is permanently broken. This puts the patient at a lifelong risk for something called lymphedema. It's a chronic, painful, and often debilitating swelling that's caused by a backup of all that lymph fluid. Our number one goal is to prevent this from ever happening.
And these are the rules for prevention. These are not suggestions, they are rules. For the rest of that patient's life, there must be no blood pressures, no IVs, and no injections on that affected arm. Period. We have to teach them to protect that arm from any little injury or infection. This is a lifelong precaution, and it's on us to make sure they, and every other healthcare provider, understand it.
Here is a super common gotcha with breast cancer medications. You have to know the difference between these two. Tamoxifen can be used in both pre- and post-menopausal women, but it has a small risk of causing uterine cancer. Anastrozole, on the other hand, is for post-menopausal women only, because it doesn't block the estrogen made by the ovaries, and its big risk is osteoporosis.
So, back to our question. The correct answer, hands down, is C. While all the other instructions are good and important, protecting that arm from blood pressures and needle sticks is the single most critical lifelong priority to prevent lymphedema.
All right, let's move on to our final content section for today. We're going to shift gears to men's health, and we're going to focus on the absolutely essential postoperative care for a very, very common procedure for benign prostatic hyperplasia, or BPH.
Okay, here's the scenario. You're 12 hours into your shift, your post-op TURP patient has that continuous bladder irrigation running. You walk in, you look at the drainage bag, and it's full of bright red blood and tons of clots. What is your priority action? Do you increase the irrigation, give a med for bladder spasms, just chart it as normal, or do you call the surgeon? This is a classic prioritization question.
The number one, top of the list, absolute nursing priority after a TURP is hemorrhage. The prostate gland is incredibly vascular, which means the risk of bleeding is very, very real. Our entire focus in that immediate post-op period is on managing this risk. So, our priorities are crystal clear. Number one is bleeding. We are watching that urine color like a hawk. A light pink, kind of fruit punch color is okay. But bright red urine, looking like ketchup, that is a huge red flag for arterial bleeding, and it's an emergency. We're also managing the CBI to prevent clots, treating painful bladder spasms, and teaching Kegels for long-term continence. This kind of vigilance is exactly what makes a safe practicing superhero nurse.
The answer has to be D. Notify the surgeon immediately. Look, increasing the irrigation might help with some tiny clots, but it is not going to stop an arterial bleed. Bright red blood means active hemorrhage, and that is a surgical emergency that requires a surgeon to intervene right now.
Wow, we have covered a lot of ground. So now, let's just boil it all down into the most essential, must-remember takeaways. This is your rapid-fire review. Ready?
For HIV, what's that magic number? It's a CD4 count less than 200. That is the line in the sand that defines an AIDS diagnosis.
For syphilis, the treatment you need to lock in for your exam is penicillin G. It is the definitive correct answer.
For post-mastectomy care, your mantra, your mission, is protect the arm. No BPs, no IVs, no injections. Lifelong lymphedema prevention is your number one priority.
And for your post-TURP patient, bright red blood is not normal. It is not an expected finding. It is a sign of hemorrhage, and that is a call the surgeon immediately emergency.
Let's just end on this thought. The reason we master these concepts isn't just to pass a test. Your knowledge is the single greatest tool you have to protect your patients.
When you really internalize these key priorities, you are taking massive steps toward becoming that safe practicing superhero nurse your patients need and deserve.
So I'll leave you with this question. Based on everything we just reviewed, what is one action you can take on your very next shift to ensure patient safety? Think about it, apply it, and go be that superhero. Thanks for joining this explainer.